Okay, so let's get started. Thank you everybody so much for coming. This is such a pleasure that we were able to get a bunch of people together today and do this virtual meeting. This is episode number 4, and I'm gonna let Sylvia Zamaripa do the introduction. I'm Marcel Kaminstein, the president of AICR, American Club of Rome. So we're happy that we were able to get everybody together, and welcome and enjoy today's discussion.
Thank you everyone for joining us today. My name is Sylvia. I am the American International Club of Rome's sponsorship director, and I've been working with Marcel on organizing these talks in hopes that we can provide our community with some helpful information in this particular time. My hope is also that we can provide information for those who might find it difficult to understand the political dynamics and perhaps even the language barrier that makes it sometimes difficult to follow the Italian news, all of the media that's being sent our way via email, through all of the social media. So hopefully these are helpful and useful. And if any of our public have ideas on talks or would like to participate in additional talks as a speaker, please do let us know. You can write into info@americanclubrome.org, and we will be happy to reach out to you and organize something on your behalf. I'd like to start with introducing our first speaker, Elise PaulHus of Council Gianni, Origoni, Grippo, e Cappelli. Elise, you have the floor.
Good evening, everyone. Thank you for this opportunity. My presentation is aimed at general information, so it's not meant at specific advice, but of course, at the end of my presentation, questions will be welcome, and we can carry on and have a discussion and a question and answer period. Now everyone is going through this kind of very difficult situation because the situations on the ground is fluctuating. There's new decrees, changes to the regulations. So around the world, but in Italy specifically, it's difficult even for lawyers to keep up. So I imagine that you, members of the club, it's also difficult, as well as for expats who have to deal with possibly what's going on here in Italy and in the United States. But all being said, these are kind of general kind of information, and I think it will be helpful. And like I said, you can ask questions more specifically at the end. So if we go specifically to, a lot of people have heard of this term force majeure. They seem to know it or may not know it. It's a concept derived from French law, as the name implies. It sounds pretty French. In Italian, it could be force maggiore. In English, in America, you often say force majeure with sort of an English or American accent. What it is anyway, it's something that is outside of the control of contracting parties, okay? So it has to be, let's say, not foreseeable, not in the control of the people, such as something like what we're going through. In the past, there were different events that would have constituted force majeure for courts or contracting parties, such as wars, possible closure of borders, which we're living now, but I mean, that has happened also before, labor suspension or labor strike and these sort of thing. So as much as it's difficult to figure out exactly how the courts will see the position in the future, we have, lawyers in Italy and in America and so forth. We have experience with these kind of concepts. Also, you should note that not all contracts have a specific force majeure clause, okay? Even if you have a force majeure clause, the thing to do is to see if they mention, for example, specifically pandemics, or do they mention closing of borders? If they do, well, your case, whatever it is, whether it's a lease, whether it's an employment agreement or anything like this, even just reading it, you may get an insight as to whether this applies to your particular situation. even if you don't have a specific clause in the agreement or the contract that you're looking to, force majeure still applies both in common law and civil law as something like, sometimes in common law it's referred as an act of God. So again, even if you don't have a force majeure clause, you still could have rights under the law. What happens is there's two scenarios, whether you have a contract with a force majeure clause or not. If the impossibility is total, okay, for example, if you're a dancer, okay, and you're supposed to dance and there's no dancing because the theater is completely closed, well, clearly this is a complete impossibility. So therefore, there, by operation of the law in most jurisdictions, the contract is terminated, okay? You may have to give notice, the owner of the theater or the ballerina, for example, but still, as a matter of law, the contract is terminated. If, on the other hand, which, in many scenarios, it's going to be, or scenari, as in Italian, if it's just more difficult or more expensive, well, in that case, people should do a couple of things. And, we've discussed what, is known as best practices. The first thing that you should be doing is don't ignore your situation, okay? If you have a lease, if you have a mortgage, if you got an employment agreement, if you got any kind of contract, you should look at it, you should be proactive. You should not just say, oh, everybody knows it's COVID-19, so therefore I don't have to do anything. That's not so advisable. Then you should try to reach out to the counterparty, whether it's the landlord or anyone like this, and then try to see what their position is, and you can try to explain what your position is, what are your limitations, to try to see if you can come up to an agreement. Because as we say, around the world, the worst agreement is probably is better than the worst of the trials. By that we mean, if two business people get together and come up with some kind of agreement, that is, could be quite, it could be better than waiting and have the courts kind of get involved in this. So if you have any questions at the moment, I'm willing to entertain specific questions. If not, I can give you more practical advice on some scenario that could likely come up in Italy. Thank you. Grazie.
Okay, we've got a question from Thomas. We're an American company who is a shareholder and a minority shareholder in an Italian company. The majority has organized a cap increase. We are having difficulty with US finance because of the crisis. Can we delay the cap increase?
So for those that are not so familiar with this terminology, it means capital increase, okay? So in other words, raise more funds, for the particular company. Of course, I don't know exactly, because even if it's in different types of companies, whether it's in Italy or the US, have different corporate laws, but just generally speaking, if it's difficult and not impossible, that would lead to, what I discussed before, which means that you can possibly come up with an agreement with, the main, the management or whatever. And delay in this particular circumstances should, possibly be acceptable because, of course, everybody, it's taking longer, the capital increase, whether the amount is the same that you need or maybe, higher and so forth. So my first reaction, without knowing the specifics of this case, would be that a delay could be asked, a delay in many situations that we've seen in my practice, Gianni Origoni, delays on both sides and forbearance, let's say, and being, let's say, more tolerant of delays and so forth, has been common practice now for the last couple of weeks.
Thank you for the question, Thomas. I'd like to turn the table now to Dr. Nico Naumann of Aventino Medical Group. Dr. Naumann, would you like to introduce yourself?
Yeah, thank you for the invitation. I'm an obstetrician gynecologist working in private practice for around 20 years now here in Rome. And I'm giving a talk about the medical aspect of this pandemia, a brief introduction to COVID-19, and then general advice to patients or potential patients, and especially then at the end to pregnant women. I suspect that some of this information is well known. Everybody knows by now, I suspect, that COVID-19 is primarily transmitted through air droplets, And that's why we recommend preventive methods like keeping distance to other people, at least a meter and a half, or even better, 2 meters, to wear face masks and to wash our hands properly, especially when we go out into public spaces, let it be public transport, let it be a shop, let it be at work, where you get in touch with other people more easily. Be aware, I think it's worth stressing this because it's a frequent question I get posed. The common face masks don't so much protect the wearer. The person who's wearing the mask is more for protecting people you get in touch with, because by speaking or coughing, you might be transmitting the virus. But the masks, if they are not really adherent and with a filter integrated, they don't protect you because the virus can also enter from, from the top and from underneath and from both sides. The symptoms also, some of you might know at least the major symptoms, but be aware there are many patients, or let's say many people who have got COVID-19 without symptoms. Estimates vary between 30 to 50%, which is quite extraordinary. So you have to imagine that perhaps someone even here of the audience might have carried already COVID-19 without being aware. The most common symptoms, if you get symptoms, consist in fever, in a cough, in a dry cough, perhaps sometimes nausea and diarrhea. But what is most worrying is if there's a pulmonary involvement with symptoms like shortness of breath. And it's really there when you get these more serious symptoms, or if the symptoms I mentioned before are long lasting for several days, let's say more than 3 to 4 days, that you might be concerned and you might need proper help. In any event, and this is now a general advice to people living here in Italy, or more specifically in Rome, to the community of the American International Club of Rome, if someone suspects to have contracted this virus or to have been in touch with someone who has been known to have contracted the virus, then the best is really to contact your GP or your family doctor or your doctor of trust. Because normally you should not run directly to the hospital, as it has happened, unfortunately, in many cases, especially at the beginning of this epidemic here in Italy and Lombardy, when people flocked all to the hospitals and were further spreading the virus. The best is really to stay in self-isolation, to talk to your doctor, and the doctor will evaluate with you if perhaps even some therapy, some pharmaceutical therapy is worth starting at home. I mean, obviously, for example, high fever can be treated with paracetamol, you know this, but there are also a bunch of other drugs which are interesting in treating symptoms, which sometimes can even slow down or avoid deterioration, which then at a certain point might make it necessary for you to attend the hospital. But again, also the decision to go to the hospital shouldn't be purely your own decision. It should be really done together with your GP or your doctor of trust. When you call, or when he or she calls, the number 112, 112, which is the emergency number for the ambulance, because it will be the ambulance service then deciding, in case you're really deteriorating, if you get brought to one of these hospitals dedicated to COVID-19. Here in Rome, we have several. It's not that each hospital is treating with this, so perhaps the hospital you're used to, because it's close to your home, is not even appropriate for this. So it will be the ambulance service deciding where you get brought, and then in the hospital, further treatment can take place. And the intention, obviously, of this type of selection, as well as our restrictions we are living right now, is not so much as to avoid spreading of the virus, which is difficult to hinder, but to decrease the speed of spreading. That's it, because we do not want to clog our emergency departments and our hospitals and to have an overstretched system, as we have seen in northern Italy or in some other parts of Europe or the US. So it's the GP who is fundamental for you to be in contact with. Interestingly for you perhaps also to know, right now here in Lazio, we are pretty well organized. It's quite surprising for us living in Italy to see the big differences between Regione and Regione, so especially again referring to Piedmont and Lombardy, here we have a very good service which is called, well, there's an acronym for it. It's SISP, it's Servizio Igiene Sanità Pubblica, which actually comes to your home to do a swab if it is appropriate to do it, not because you wish it simply to have a swab, but because in accordance with your GP, the decision has been made. Now, there are many more things I could say about this, but I wanted especially to focus also on pregnancy. This was the original intention of this talk. The good news, well, the reassuring news is there are many pregnant women who have got COVID-19, not only in Italy, also in other countries, but so far, none of these women had a major complication. So none of these women needed, let's say, intensive care, artificial respiration. Interestingly, pregnant women who are normally pretty susceptible to viral infections are not really the main target, obviously, of this virus. They're not really part of this most vulnerable group, which we thought at the beginning. And furthermore, there's no sign of transmission intrauterus through the placental barrier onto the fetus. Also, this is quite bizarre. Perhaps not everybody knows about it, but there are many viruses which easily get transmitted onto the baby. Take, for example, chickenpox or cytomegalovirus. But this is not true for COVID-19. And a further reassurance can be that also giving birth, or better, newborns, babies, who have had COVID-19 infection haven't experienced any major complication. Also, this is unusual because normally a newborn is highly susceptible to viral infection. Again, good example is chickenpox or whooping cough. And so we can say here in Rome, in Italy, you can be at least pretty confident in giving birth, and also in giving birth by spontaneous, by natural means. Obviously, the hospital, for example, when I'm working, we all dress up properly, we get our protective gowns and our face masks, but everybody is relatively free in giving birth at under the conditions they like. Let it be the position they like, let it be the anesthesia they prefer or not. We even do, for example, water deliveries. So we haven't really changed so much on this behalf. It's more about the screening when entering the clinic and the supervision of the people attending there, because obviously you do not want anybody to carry and to spread perhaps this virus. Perhaps as a last point, I thought to give some hints about the antibody test, because again, this is also a question which I very frequently get asked about testing. Well, you remember the testing for COVID-19 is normally a swab. The swab you do on your throat, and there you can detect genetic material from the virus, and when it's positive, okay, it's positive. But it doesn't tell you anything about a past infection or about your immunity. So everybody's looking right now for antibody tests. Antibody tests are simply tests detecting antibodies, which are molecules produced by our body in response, as a defense response to a viral infection. And there are several antibodies. Some of them will tell you it's an acute infection. Others are able to determine if this has been a past infection of some weeks or months ago. And there are many of these tests around. I've seen also here in Rome, some labs are offering this. Please be aware, these tests are not approved by the, well, let it be in America, by the FDA or equivalent entities here in Europe. So there are many labs doing their business with this, and you do not know to which extent these tests have their necessary specificity and sensibility. So you get many false negative results and also even false positive results. Be aware of this because this would give you a false safety or a perception of safety which cannot be guaranteed by this test at this point.
Doctor, what can you suggest to someone who is, let's say somebody who's, I guess, not even ready to give birth now, but let's say someone is, let's say midterm and they're at home, they're doing the quarantine. What's some word of advice for them to stay safe?
Well, you obviously recommend the usual safety and protective measures. The self-isolation is not really necessary. As long as you haven't contracted the virus, you can go out, you wear your face mask if you're in contact with others. Indeed, we see patients on a regular basis. So these women come from their home to our hospital. No, there's no specific restriction. We can say a pregnant woman can move around like everybody else.
One of the things that that I've noted in a lot of the readings is that women are less susceptible to coronavirus than men are. I would assume that this would be in the favor of any woman that is pregnant. They would hopefully have even further built up immunities due to the pregnancy. Would you suggest that's correct?
Yes and not. You have to know in pregnancy, a woman is more susceptible because the immune system is much more tolerant. So as I said before, there are certain viruses, when you get infected by these viruses, unfortunately, it can be quite complicating for the pregnancy, not only for the mother, but especially for the fetus. So let's say the suspect is that here are some specific biochemical markers which make it more easy for this a virus to enter, let's say, a vulnerable person, which we define more either by age or because it's an immune depressed person or a person with underlying pathologies. You might have read about it, like diabetes and hypertension. But it's not really clear exactly this mechanism. But we cannot say in principle that a pregnant woman is not susceptible to a viral infection like any other else. Sorry, that's not possible. In this case, yes.
Sylvia.
Thank you very much, Doctor. I'd like to turn the floor over to Dr. Patrick Longhi, Assistant Professor at Tor Vergata University.
Thank you. So I will give you a perspective of what has happened in higher education in the public sector in Italy. As from the 4th of March, Wednesday the 4th of March was basically the last day in which schools and universities were open to the public, open to the students. I mean, on the evening of the 4th, there was a decree for which university and schools were locked down. And so no more in classroom activities went on from that point. The situation at the moment is they are waiting the 18th of May for a further decision. And most probably this decision will be to keep the classrooms closed to the end of this school year, so up to June. And hoping to go back to some form of a classroom in September. So there's some difference between universities and schools. Probably universities are more ready for digital forms of teaching, since already most of our lectures we use PowerPoint slides or PDFs, so a lot of the material is already available to the teachers. Students, or most of the students, have access to PCs, tablets, their own SIM cards. So from a university point of view, probably this was much easier than high school or junior schools, where really teachers and students were not prepared for this transition. So if we focus on universities, quite surprisingly, I would say, considering Italy, which is the country I love, I live in, things were quite fast because basically we've more than a month has gone by. We have already the first statistics made available by the Ministry for Higher Education. And basically 80 or nearly 90% of university courses went online within a week, which is a great result, considering that we have more than 1 million students studying at university in Italy. And surprisingly, even more surprisingly, I would say, there were more than 70,000 exams in March and 26,000 graduations. So students who had the opportunity to discuss the thesis at the end of their course and graduate even during this lockup time. So which are the tools we are using at the moment? We are here at Vergata, we have several tools, but they're very general because we have Microsoft Teams, we have Cisco WebEx, we have Google Classrooms. Since the decision was made very quick, some departments opted for some tools while other departments opted for others. And now at the moment, the Central University is trying to decide the single strategy, which will most probably go ahead in the next semester. So the first semester of 2020-2021 year, so from September onwards. These tools are very effective, I would say. They are very easy to use. There is, they provide interaction between students and teachers through live web meetings organized just like this one, I would say, with the possibility to share information. There's also the possibility to give tasks within a certain deadline, to assign tasks to every student with deadlines. So we have a constant monitoring on who's preparing their tasks and completing their tasks within the given time. So we have also a time-based measurement, and then of course each teacher will perform a quality-based measurement. So we have each student has the opportunity he has a calendar and agenda in which he sees when his tasks are due. And from a certain point of view, this is even better than in classroom teaching, because it's not so controlled from an agenda point of view, and so on. So, and even surprisingly enough, schools and universities are given the possibility to provide devices and connection to students. Usually these are made available on an economic basis, so families with lower income have access to these opportunities and these opportunities are made available by schools or universities. So even if it was a really great change for the higher education sector and the education sector, I would say it was the only way is change, adapt, and survive. And at the moment, I feel that in these difficult times, the system has reacted, and overall it has reacted well with good results. So from now it seems this is all good news. Is it really? Well, no, it is not all good news, because higher education is also linked to research activities, and research activities, especially in the STEM, so science, technology, engineering, and maths, needs to be carried out in teams, and most of all inside laboratories. So the fact that the laboratories are not easily accessible at this time, and that people are confined at home, makes it difficult for them to carry out and continue their research activities. So if research activity is carried out mainly at your PC workstation, it can still go on rather smoothly. While if it relies on laboratory testing and team meetings in laboratories, it has become a bit, it has slowed down. And another aspect is teaching online doesn't really give the teacher the feedback from the students. It is so important that when the teacher speaks, he sees the student, he sees their reaction, he can see if they're following or not. And so I would say that this is not the future, if we would want to close my contribution in this way. I mean, I believe that teaching is still very much a fact of relationship with the students. So this is an opportunity in a difficult time, but as a teacher, I wouldn't say this is the future of teaching and higher education. Thank you, Sylvia.
Thank you, Professor. That brings us to the conclusion of our three speakers and their contribution to how COVID-19 is affecting their respective professions and industries. Marcel, would you like to open to public Q&A?
Sure. Let me start with one really quick question for the professor. I was kind of talking the other day, trying to figure out, what do you think the impact is on private education versus public education in terms of the students' cost of attending? So normally the attendance cost for a public school is much lower than the cost for a private school. I would assume from a business point of view that the margins will be heavily eroded for the private schools, given that if they're not going to be able to meet in these wonderful campuses, how is that going to affect their enrollment rate and their profitability overall? What do you think as a professor?
I think that the public sector, of course, has a large amount of public funding and in Italy, and most of its revenues come from public funding. So at least in the short time, there will probably be less hit by this crisis. Public, yes, private universities might be hit. Not as much in maybe this year, but maybe they might see a drop in the next year's enrollment due to the fact that the crisis will move the families to be less spending and maybe prefer, let's say, the more cheaper public universities than private universities. So I imagine private universities will have to find a way to challenge this crisis and come up with new ideas, new opportunities to remain attractive as with respect to the public sector.
Thank you so much. There was one question from Thomas. Thomas had asked, the government says, don't go to the hospital unless there's an emergency. But it seems that there's a treatment gap between options and medicine available at home with doctor supervision and versus, let's say, an emergency room visit at the hospital. What outpatient treatments are approved and available now for hospital emergency and intubations, ventilator, etc., and also chloroquine and the Z-Pak? What do you suggest on that in terms of treatments? Dr. Naumann?
Thanks for the question. I tried to give an answer to this before. I was saying, this is something you have to deal with or let's say to discuss with your GP, because things that are feasible to be done at home, let it be an anti-inflammatory drug, let it be paracetamol, let it be even antibiotic, can be given without any doubt. But beware, chloroquine, which very much gets promoted by some countries, is not really something that is certain to be the wonder drug it was thought to. It can be of use, and indeed, right now, for example, chloroquine specifically in Italy is given only to the public hospitals, to the COVID-19 units. It's part of the protocol, that's correct, but it's only one of these pieces which is part of this protocol. Other drugs which are given, for example, like cortisone, again, are very difficult to administer by yourself at home. It's not that the GP or your family doctor should come and see you necessarily. It's more a virtual consultation that takes place. And if there's a deterioration, then you go to the hospital and then you get drugs like cortisone, chloroquine, perhaps heparin, because interestingly, it has been found that most of these pulmonary deterioration is related also to the fact that the inflammatory process affects the vascular system, causing many, many microclots, which then block and clot, in principle, the blood supply to the lung, and hence the exchange of oxygen. So heparin, another drug, and then last not least, if necessary, the intensive care. So there's a clear divide and there's a clear strategy. And I think, and that's another thing I wanted to stress before, it's not bad as we have it here in central Italy, and in most regions, let's say, now we have established this SISP, the service which comes to your home also to test you. So this is very much different from what we had, let's say, a month, 6 weeks ago, when everybody who didn't feel well was sent simply to the hospital, creating only chaos and then spreading further the virus. And remember, in northern Italy, it's not only that patients die, it's also lots of healthcare workers, over 100 doctors. That's really incredible, because these people didn't have not only the right protection, they didn't get tested, but they were also overwhelmed by all these people coming in. And this situation has very much changed, and it's very much different here in Lazio, which is, I think, of great reassurance to people living in this area or in Rome, obviously.
Appreciate that. That was a great answer. Sylvia, do you want to jump in?
Yes, I believe that Elise had a question.
Okay, just to, let's say, be practical under Italian law, I would like to introduce the people to my colleague, Riccardo Gotti-Tedeschi, who is, as I mentioned earlier, is Italian and Italian qualified. And beyond what I suggested would be best practice generally in sort of international environment between, you know, expats or US companies or Italian companies doing business in America or vice versa, I was wondering if Riccardo had a few, one or two kind of things that he thinks could be of interest to share with everyone. And just before I introduce Riccardo, also one thing that I wanted to complete when I made my presentation, if you do come up with some kind of agreement with the counterparty, being the, you know, the employer, being the landlord, try to put it in writing. Even if you don't have a lawyer, just, you know, emails of something that will be very helpful going forward in proving what the meeting of the minds, as we call it, you know, was arrived. Also, if to the extent you can, that it's not completely impossible for the contract to be performed, try to fulfill your side of the bargain, okay? If you cannot pay the full rent, for example, commercial rent, well, try to pay half of it, or, you know, something that shows that you're in good faith, which is an obligation to act in good faith in many jurisdictions. And so that would be useful for your case, beyond also obviously the relationship that could be preserved with a counterparty. The last thing I will say also is try to mitigate damages. So for example, if you were a landlord and somehow somebody came and said, oh, I'm interested now, you know, I want to expand for some reason because, you know, the other business is not going so well. Well, it could be interesting for one party to actually, you know, see if they can voluntarily terminate one agreement and enter into the next, and so would reduce the liability, potential liability. So I'll turn now to Riccardo. Riccardo, would you have something, one or two things under Italian law that could be useful for people that reside, either, you know, being companies or individuals?
Thank you very much. Thanks for this invitation. Very happy to be here with you. Thanks, Elise. As to your presentation, I don't want to add too much, but considering the Italian situation and the multitude, I would say, the bulk of decrees that we have been bombed by in the last month and a half by the government and by the regions and by the local authorities, which is really a lot of work for the lawyers, first of all, to understand and to give an order to all this to all this discipline and these regulations that required to be somehow put in order. There is a specific issue that, well, let's say a practical note that can be very helpful for all of us, considering the force majeure application as a principle. Well, as Elise was saying, the issue of the force majeure, which can bring to the termination of a contract, is strictly related in all the jurisdictions, including Italy, to the burden of proof, which is up to the entity which is not able to comply with the obligation, with the contractual obligation. In this regard, the chambers of commerce in Italy have now a specific power somehow after the decree of the Ministry of Development of March 25, and following through several previous decrees that also distinguished specific activities which are considered as essential in this course of events from those activities which are not essential. The chambers of commerce, each chamber of commerce may release a specific statement to the interested company that, for instance, is not able to comply with a specific obligation, a contractual obligation, and this statement, which of course is a statement according to which such company may prove not to carry out an essential activity according to the decrees in force. As a matter of fact, this statement by the chambers of commerce can be a specific help, a specific evidence for the benefit of the addressed company, once it has to prove that, well, in the context of a termination of an agreement or a suspension of the performance. And this can be extremely helpful, especially in order not to trigger penalty clauses in the specific contracts.
Yes, thank you very much. That was excellent. Appreciate that. I wanted to, were there any other questions that anybody had?
John Stewart.
John, how are you,
Yeah.
John?
Hi, I'm good. I had a couple of questions. Very interesting range. One question, I was very pleased and listening to Dr. Naumann, Nico Naumann, about the situation in Rome and the health service here in Lazio, which seems to have been performing relatively well. Of course, the lockdown, I mean, we know the north of Italy was hit very, very hard, and it was hit probably harder and faster than anywhere else in the world apart from China. Nevertheless, I mean, there's been a lot of controversy in Lombardy about the way the region has been dealing with it, and there's been a bit of some conflicts between, the regional powers and central government powers in Italy. I wonder if Dr. Naumann might be able to comment something on that. I mean, the fact that Lazio does seem to have been performing, and Rome seems to have been performing quite well. I would add something to that as well, just in terms, this is perhaps a bit of a romantic vision of Rome, and I've worked in Milan for 7 years, and I've now lived in Rome for 20. And I know where I prefer to live, and that is Rome, for many reasons. One of the reasons being the landscape of Rome, and the fact that Rome is a big city with a lot of people, but it's very sparsely populated. It's very widespread. It's actually one of the cities which is more spread out compared to other European cities. And it has a lot of, people forget how much green there is, how much space there is in Rome. I just wondered if, I understand that Dr. Naumann has also lived in Rome for some time, where he thinks there is a climatic or an environmental difference or advantage that Rome has compared to Milan, which is, Milan, of course, is very densely populated, much less green space. That would be my question, two questions, as it were. if I may, to Dr. Naumann. One is on the way the conflicts, and we see this also in the United States, of course, the conflict of powers and of how to manage at a regional level compared to central government powers, federal and state. The same thing here in Italy, but Lombardy and Lazio, and why perhaps Lazio has been coping better. And then there's that environmental question. And that would be, and then I would have also a question to Dr. Longhi, Professor Longhi from Tor Vergata, not actually about universities, but there's a lot of controversy in the last couple of days about Italian schools potentially not going back at all, and this summer. And there was a suggestion that the school terms could have been delayed, perhaps, and extended to July. But apparently, not surprisingly, perhaps students were polled about this and suggested they didn't want to go back to school in July, which is perhaps understandable. But apparently, also the teaching staff don't want to go back in July. And I would compare that situation to France, which seems to be, Macron said yesterday that they're looking for schools to go back, potentially schools, not universities, in May and June because of the effect that a lack of children being kept at home would have on their on young people's welfare. So I wondered if you might like to comment on that, about the idea that young people, school children, and not having any kind of school education until potentially by September or October. Thank you.
Yeah, I will try to give you an answer. I mean, I would like also to talk about your second question, because I have two youngsters of 16 and 14 years of age. So it's obviously of great interest to me, this whole issue about school education. But, obviously I'm not an epidemiologist. I'm a gynecologist obstetrician. But also I've thought about these strange differences, this patchwork of COVID-19 pandemia, and you're wondering why. And there are many factors. There are many factors involved. I doubt that it's really related to the famous smog in Pianura Padana. You say the dense population, yes, all this might be true, but again, let's say the unfortunate cluster in Lombardy is certainly also related to the fact that's where it started, and nobody was really prepared for it. And I think retrospectively we have to say that the central government was very courageous at a certain point to put in these restrictions, and we are now having them all over Europe, because at the beginning, everybody was laughing about it. It was thinking, Jesus, what are they doing there in Lombardy, to lock down, and then later whole of Italy. This wasn't an issue in Great Britain, it wasn't an issue in France, and not even in Germany, and not Switzerland for sure, and Scandinavia. So they were the very first who had to take these tough measures. I think in my talk, I tried to mention or to explain one thing. It's very important to know in Lombardy, you have very excellent hospitals. So the public healthcare system has very much focused over these last decades on these centers of excellency. But to my knowledge, knowing many people up there, you have to know I studied in Pavia, which is a small university town close to Milan. The periphery, I wouldn't say has been abandoned, but has not the healthcare infrastructure we will face or we will see in some other regions. And that's what I mentioned when I said here in Lazio, strange enough, in Lazio, where there are many problems, but in the periphery, not only in the external quarters of Rome, but also outside Rome, the system of caring for people in their homes, in their small villages, works quite well. And indeed, you do not only have the GP, but you have also several units driving around, going to see and visit and do tests locally or at home even. So that's quite a good service. And this is exactly one of the problems that arose in Lombardy, because everybody was flocking to these big hospitals where doctors, healthcare workers were infected, and they didn't even know at the beginning, obviously, how to treat properly. They didn't even have all the drugs. Imagine even the diagnosis was wrong. You remember at the beginning, everybody was talking about the interstitial pneumonia. Today we know it's not an interstitial pneumonia. It's related to the clots, which I tried to explain before to you. So the whole pathophysiology has changed over these recent weeks, since we are better understanding what's really going on. And so simply these people weren't properly prepared, and the hospitals themselves were spreading the COVID-19. This is my interpretation. And then we can talk obviously about this whole strange phenomenon, which is something which makes me very much reflect. How does it come that in Asia, Taiwan, Singapore, Hong Kong, South Korea, and some other states have been able to do preventively here the measures, the restrictions, and to deal with this virus, and we here in Europe, or even in the US, we are not able to do that. And even after the terrible experience in Lombardy, in Italy, Germany took a long time to take the restrictions, to impose the restrictions. So we did exactly the same errors in Germany, for example, closing bars in the evening at 6 o'clock, but at midday everybody could mingle. This doesn't make sense. And again, then we had a very similar situation in the UK. So it's bizarre to see how even our political class is not able to learn from the experience of others, in this case from Asia. And this is very scary to acknowledge. This is something that makes me very much reflect on how we deal in future with these crises, which are obviously not knowing any border.
You touched on a great point, which gets into a lot of health public policy, which I see a lot of the same thing here. Just to give you an example, when I'm in a unique position because I'm so close to Italy, being president of American Club, I was hosting a lot of these conferences. I was speaking with friends. I was speaking with the embassy. And one of the things that you start to get an understanding is when you see this wave coming over from China and then over to Italy, you know, in the US, we already knew what was coming, but most of our public servants who are in the government or in, you know, public health, a lot of them didn't know what was going to come. You know, it's one thing to hear something on TV and say, oh, well, Italy's having this situation, there's an outbreak there, but it's very different if the leadership in your country doesn't organize from the top down. And this isn't a critique of our government, but if the information doesn't come from the top down, then you can't expect that people lower down on the totem pole are able to react or take initiative to do things. And in fact, you saw this play out between, you know, at the same time that I was, you know, understanding that things were happening from Italy coming over to the US before it had really happened in the US. Working for a government campaign, presidential campaign, I reached out to my local political campaign personnel and I told them, hey, get ready for this because it's on its way over. Make sure that you guys are prepared. Make sure that the local leadership is prepared. And a couple of weeks later, finally, you know, it started to move. That information went over to the governors. So that's really a public health issue. And I was lucky to have worked for Bloomberg, and Bloomberg with Johns Hopkins, Bloomberg School of Health, has been instrumental in getting a lot of information and data out to the world. So it's interesting that you brought that up. Let me switch over the last part of that question that John had was for Patrick. Patrick, could you touch on that last question?
Yes, John was asking, what about high school, junior school? What is the situation there? So the situation about going to school in June and July in Italy, I think there are also some practical aspects. Consider that especially south of Rome, the south of Italy, it does tend to be really hot in those months and maybe higher than 40 degrees in the day. And schools are not prepared with air conditioning because when they were built with the idea that they were going to close at the beginning of June. So I think it is quite unpractical to think in some parts of Italy, especially the south, that schools can open in June, July. especially for the younger students, due to practical issues such as the heat. I don't think there are really other reasons apart from that. Although one could think of other organizations, maybe early in the morning or late in the afternoon, but that would be quite a burden on the families. I have spoken to to the headmasters of my local school, and the objective for this second part of the year is not really syllabus oriented to complete a program. The objective is to keep the classroom united. So really the main reason for which every day the students, I am talking here about the junior schools really, but also the middle schools, let's say up to 14, maybe 14-year-olds, from kindergarten to 14-year-olds. The main objective is to keep alive a sense of community inside the classroom. So having a daily contact with them, with their teachers, having a daily contact with most of their friends that they don't see anymore since now 6 weeks or more. And let's say the part of knowledge or notion is really secondary with respect to this higher concept of keeping the community together. So this is why I think that the school will, this form of schooling will end maybe at the beginning of June, mid of June, and then it will begin again in September in a form that it's still under study, it's still under evaluation. And I think no one at the moment really knows how things will be in September. Maybe a mix of some days in classroom and some days at home. I imagine it depends how this disease spreads or goes away during the next few months.
Lisa,
there is also
Lisa had a question for you as well. Has Tor Vergata made a decision in regards to the Erasmus program planned for the first semester of the 2021, so in September, August?
Okay, thank you very much for this question. Let's say consider that Erasmus is a European program, so it's the decision is not left to the single university, but it will be a decision when it will be taken. It will be taken at a European level. Things are still very fluid, very dynamic, and all decisions have been postponed. But consider the situation is at the moment, and the legal friends that are part of the panel probably better informed than I am. But at the moment, I don't think it is even possible for people to go abroad unless there is a specific and urgent reason. So, and I imagine that this limitation in going abroad will stay on for at least some time. So, one of the first questions that maybe our legal friends will be able to answer is what are the situation concerning about the possibility of people going abroad, and when they think that these limitations will be taken away.
Thanks. Yeah, that's good. We'll end this session now. I want to thank everybody for coming, and thank you very much, Sylvia, for organizing this. This is episode 4. We've had a lot of very interesting speakers on, some great minds, and we really appreciate you guys contributing to today's session, answering questions for our local community. The American Club of Rome is, we're here for our community. We've, been here since 1953, so we are going to continue to be present in Rome and to work together with our local community, with our embassy, with our American and Italian and international expats. So we thank everybody for joining today. Sylvia, can you close up the statement?
Yes, absolutely. I just wanted to reiterate what Marcel has said and thank personally Elise for her support in organizing this with me. I appreciate your time and dedication to me and to the club. Dr. Naumann, thank you so much for reaching out to us and volunteering to speak on our panel. And Professor Longhi, thank you as well for dedicating your time. Your speech was very informative, and I'm sure a lot of people will have even more questions to ask. So hopefully this will stimulate further conversations for other Zoom conference chats that we have in the future. Thank you to all of our guests. I invite you to send us any questions you might have that you'd like for us to answer, or we could possibly organize other talks around the questions you have. You can send those in again to info@americanclubrome.org. Thank you, everyone, and we will see you next time.